All right, guys, Nick Drossos.
And Dr. Laurent here today.
And today we're going to be talking about peptides. So
Well, peptides.
we hear a lot about them, and it's more and more athletes are using them.
Yes.
And as I'm getting older, people are telling me you should look into it.
Yeah.
And I want to know, Doc, before I take them, what are exactly peptides?
First and foremost, you need to understand that peptides are, let's say, small proteins. Okay. It's improper to say they are small proteins because a proteins is, a mix of peptides. So a peptide is actually a compound of amino acid. It's a small chain of amino acid.
Okay.
If you have at least 2 amino acid, you will have a peptide.
Okay.
Okay, we have many peptides in our body. So most hormones that we have that are not steroids,
Okay.
that are not steroids,
Okay.
are peptides.
Okay.
Yes, like insulin.
Okay.
Yeah. So glucagon, peptide. Okay, we have growth hormones. We can use a peptide in many spheres of life, just not only in bodybuilding.
Okay.
Okay, we use peptide in medicine, like let's say to treat diabetes, like insulin. As I just told you, like cancer, hormone deficiencies. We also use them in vaccines.
Okay.
They can be used as stabilizers.
I know it. I know it more for like recovery for injuries.
Yes, that's one. That's one
Okay.
of many peptides.
Okay.
It's BPC 157. That's the one that they talk about the most.
And how does it work? Like, for me, as I'm getting older, I have more injuries.
Yes, the more you get old, the less testosterone you have. Okay, testosterone as a role is to help you with recovery. Okay, to make sure that you don't have pain after sports, after daily life. So you will see when we get to 70, 65, or 55, maybe we will starting to have pain. It's a pain that doesn't come from the muscle itself, but from the tendon, that we will have some micro tears there that since you don't have enough testosterone to repair all that for you, so you will have the pain that comes with it. We also use peptides in other spheres too, in cosmetics.
Okay.
Yes. We have the exosomes that we put on your skin, that we put on your hair, the ones that we put for dark spots. Okay.
So when you're saying you take peptides, it
Yeah.
could be in a cream form, a needle
It could be in a
form,
cream
it could
form,
be pill form.
any form. But
Okay.
if you take a peptide and it goes through your stomach, you need to make sure that your stomach will degrade it.
Okay.
It will degrade it. You will end up with the amino acid that have the chance to form other proteins, other peptides, not necessarily the one that you took. So that's a thing. And in biotechnology too, like enzymes design, we can have a specific enzymes that work with a specific receptor because of a peptide. Okay, the peptide just conditions it to be of that use.
And how do you, like, when is it normally prescribed, like a peptide? Do you ask for it? Does your doctor said, well, we suggest
Peptide.
peptide?
Usually, we have so many peptides out there because that's why it's such a big question.
Is it, sorry, I'm cutting you off. I think,
It's
is
like-
it something new? Because
It's not new.
it's always been around. Just I'm
been
hearing
around.
more and more about it. Maybe because I'm
Yes,
getting
because a
older.
lot of people are taking it. More people are taking it. It's more, now it's more accessible for everybody, and we have more smaller labs that are doing it.
Okay.
That make it affordable for other people to have. But before that,
Is it normally covered, or is it something you have to pay?
none of this is covered.
Is it expensive?
Let me read it for you, what it says about BPC 157. This peptide is taught to promote muscle repair and recovery by influencing cell migration and tissue regeneration. Taught to be was linked. There is no actual proof. We don't have research enough to say for sure this is working.
That the peptides.
Yes, sir. We can have a person that takes it that's tell another one, oh, I thought this is works for me, but that person is not in the same state as you.
Okay.
Okay. You might have, you might not tolerate it. You might have some side effect from it. Other people can take things, but personally, it's something as a doctor that I cannot recommend. If
Oh,
you,
you don't?
I will not.
But do other doctors do, or normally they
Maybe.
don't? Okay.
Maybe, but me personally, as of well, let's say today at this hour, I do not recommend that people take a peptide that is still in research for muscle growth or something. People are always trying to get away from testosterone and growth hormone, okay? But what they are looking for is the exact same effect of these things.
So the peptide is parallel to TRT then?
It's
Kind of.
parallel. It's
Does it have the same effect or no?
not necessarily.
Okay.
They can give you something that looks like it,
Okay.
but doesn't cover everything. With a peptide, you will have one function, but not all of them. Let's say a bodybuilder will take that BPC. So they want to promote muscle growth, muscle mass, muscle healing.
Yes.
Okay, that's what they want. But what other hormone does that? Testosterone. That this is its role. That's its role. Okay, in your body, you take that, but now people are getting more aware of it. It can cause problems. Okay, not heart issues actually. If you
The TRT, right?
TRT
Yeah.
doesn't. If you
Yeah.
don't take an anastrozole,
Yeah, we talked about that.
Exactly.
And it's interesting because there's still that
yes, a lot of doctors are still doing it, are still telling people since you're taking testosterone, you need an anastrozole. No, you don't. Okay. And on Friday, I saw a patient. We talked about that for an hour. He was on testosterone and had that testicular problem.
okay.
And he was telling me, "Oh, I have pain there." I'm like, "Oh, I will examine you." I examined him, but his testicles were a bit mushy. I'm like, "Are you on testosterone?"
Oh, wow.
He said, "How do you know that?" I'm like, "Well, I touched your testes and
Tell. Wow.
and I could tell." It was like, "Oh, I was so shy to talk about that," and we talked about it for an hour. And I explained to him that you won't have the gynecomastia with estrogen. No, it's fat that does that to you.
Okay.
It's not estrogen.
I thought it was estrogen.
No. If you dose me now, I easily have a 700. It's what a woman would have.
Oh, wow.
As a man, I have that level of estrogen, and I'm losing weight. That estrogen makes you lose weight.
Okay.
Yes, that's why in menopause, women gain weight.
Mm.
Basically,
Okay.
yes. So peptides. There is another one. There is that CJC 1295 that is used in conjunction with other peptides. Okay, that stimulate the release of growth hormone.
Okay.
Okay, and can aid in, muscle development.
Like if I want to put on size, now I'm training, I want to put on size.
I will put you on testosterone.
I want to
Period.
lean down, but my TRT levels are good.
Who said what I'm gonna do is gonna be okay.
Well, if my levels are already okay,
What is
I,
okay?
I think I was at 23 or 24.
So take a deep breath. It's not. It's not optimized. Your level for your age is okay,
Yes.
but it's not a level for a 20 years old because what you need to do, what you want is like you were in your 20s, right? So I need to
Is
bring
it
you
is,
back there.
is it realistic? Like,
It
I mean, as long
is.
as I'm good for my age. That's what I was thinking. I wanted, like, I hear all the older men, they're all on the peptides.
Mm-hmm.
Like my age and older for recovery and so you think TRT?
I would prefer to give TRT because this is safer.
Oh, wow.
TRT was most studied than peptides.
What are the drawbacks or the negative if there's what like any causes
When
peptides?
you don't know, when the science cannot tell you yet
Good point.
about the side effects,
Side effects.
I will not recommend a thing that I don't know. I can if I tell you to go through that door and I don't know what is behind that door, I might be responsible for your death, right?
Yeah.
So I cannot recommend this today.
So you don't like
No.
and so then why is it out in the market if it's not been studied?
Can
How,
you
how,
buy it
how-
at a pharmacy? No,
it's a prescription. The doctor has to give it to you.
not necessarily.
Okay. On the black
Compounding
market?
pharmacy can give it to you. Yes, some doctors might give it to you. That
Okay.
BPC 157, it's from compounding pharmacy.
Okay.
Yes, some doctors will prescribe it to you, but it's not studied enough.
Okay.
Because as a doctor myself who studied men, who has an interest in men's health, you know, I love to do proven medicine,
Okay.
EBM, evidence-based medicine. So if I want to do that, I cannot recommend that peptide for now because if I let's say, am I gonna take it? Maybe. Can I recommend it to you? I'm not sure
Yeah.
because
You're responsible.
exactly
Okay.
I can risk myself, but I don't want to risk you. You know, it's my responsibility. So I will be I will be liable for anything that happens to you. Okay. And other peptides like Ozempic is a peptide.
Oh, no way.
Yes, it's a GLP-1.
Okay.
Glucagon like peptide.
So I'm getting
One.
confused now. A
Yes.
peptide is
Can be
just
anything.
can be anything.
Yes.
So I thought I was under the impression a peptide is like
No.
a treatment
No.
for muscle growth,
No.
repair,
No.
recovery.
No.
Okay.
That's why
I
when
guess
you
because the
ask me,
bodybuilders are using it
exactly.
mostly. Okay.
When you ask me, oh, can we talk about peptides? I'm like, which one?
You see. Oh, that's so much
That's
because all the information I got was from all the bodybuilders, all the
exactly.
big guys who are taking it. And
Exactly.
They talked about it even here when we did a
that
podcast.
that BPC was good. That's what I told them. Well, I didn't know about it at the time. I learned about it, but what I saw, it's still in research.
Okay.
They're researching it now in Montreal. So
There's risk. You don't know.
I don't know. I prefer to be honest,
Yeah.
okay, and get less views
Yeah.
instead of saying things like,
Go out and get your peptides. You'll be good.
yeah, I cannot say that.
And I think that's the good thing, guys, about our show, and that's why I love having you and doctors here because we don't want to give misinformation, especially on the
No.
internet. There's so much. Everybody's reading or studying, and they're not doctors, and they're just
They are saying things.
they're saying things where
They're
I'm like,
saying
you're
things.
actually playing with people's health. So it's
And some people might come to me as a doctor and tell me, doc, I saw this guy on YouTube saying this and that. I'm like, who is that person? Well, I don't know. It's a guy on YouTube. I'm like, okay, but you came to see me as a doctor. Do I compare to that guy? Like, oh no, do not be offended. I'm like, no, I'm not offended. I'm just asking a question. I'm just curious. Okay, because that's when someone is saying a thing, the person needs to have a background for it. If a biochemist sit down with me here, tells me that they recommend a peptide, I will ask them, please show me the paper, show me the research on it. I will gladly sit down, take time and read it. Okay, because it's no time for ego, it's time for learning.
Yeah.
I am dealing with human, so I need to know. As a doctor, I need to know if I have a patient that comes to me and asks for that, I could give them a good advice if I know. But if I don't know, well, I'll say, well, I don't know. That's the best answer that I can give them. But peptides are everywhere.
Okay.
Okay? Peptides are everywhere in your body. A lot of hormones that you have are peptides. Okay? You have two types of hormones. You have the cholesterol based ones, the peptide based ones.
Yeah.
Yes. The ones that are steroids, all the steroids
Okay.
are based on cholesterol. The other ones are usually based on a peptide.
Okay.
Yeah. So that is to finish this today.
Yeah.
Let me say something that every fifth grader will understand.
Yes, that's what I like. Because I was completely
Lost.
lost and off with what I believe.
A peptide, okay? A peptide can be anywhere. It's like air, okay? It's everywhere. It's like oxygen. So
It's in our body, right?
exactly.
It's-
We have so many of them. We are made of peptides,
Okay.
okay? And fat and water, of course. and sugar and stuff like that. And you need to understand a protein is a complex of peptides. Okay? A peptide is a compound of amino acid. Can be just two of them. Two amino acid will give you a peptide.
That's it.
Period. A peptide, when you have one single file of amino acid, you will have a peptide. When you have more than one, you will call it a protein because it's a complex of peptides.
And is there like different grades of it and different
Yes.
like compounds of it? Like
Yes, we have, if I'm not mistaken, 22 essential amino acid in human. Yes. So all of these,
combinations make
Combinations.
different peptides.
different peptides and
For what
different
your body
proteins.
needs.
Yes. And also, you can have the same compound, but with only just a structure that changes.
Okay.
It's something completely different. Yeah.
I think I learned something new today, that's for sure. And I'm like,
you can use it anywhere from
Yeah.
medicine to aesthetics to, to research to agriculture. Yes. Pest control. To do
peptide.
that, peptides mostly. So overall, peptides are very versatile. So you can use them in a lot of ways. Okay, so therapeutic and industrial applications. You can use them anywhere.
I think I might look into it. For my shoulder.
You can either look into
Yeah.
it or come see me at my clinic. Who will sit down.
And
I will
do an
drain blood for
evaluation.
you.
Oh, that's true.
We need to drain blood. We need to
Oh, and-
measure.
yeah, that's how you see it if you need one?
Yes. I will drain blood. I will have proof. I will show you on paper where we can optimize. That's what I do with all my patients.
So a question, and I didn't think about it, is that's how you know if you're missing, like you need a blood test before you.
Take anything, okay? Take a blood test. And you need specific blood test.
To see if you need peptides.
Not necessarily
No.
peptides.
Okay.
I
Or
was
if you're missing
TRT.
TRT. Okay.
we can base ourselves on symptoms, but if I look at you, I'll say, oh, it doesn't need anything.
Yeah,
But if I test you,
that's the best
I
way.
can see something completely different. I won't say it's the best way. I will say it's a better way of doing it, because I could base myself on symptoms, on pain that you might have to optimize either your thyroid or your TRT. You know?
Awesome. So, guys, I hope you enjoyed this episode. If you have any comments, if you have any more questions, leave them in the box.
Oh, please do.
Make sure to subscribe and hit the bell, guys, and we'll see you next week.
Bye.